We've covered a lot of ground so far today. It is now time to think about health. Dr. Abisola Olulade is here with us to discuss telemedicine visits. Let's welcome Dr. Olulade.
Thank you so much for having me. I am Dr. Olulade. I am board certified in family medicine, and I've been in practice for 9 years. I've been with Sharp Rees-Stealy Medical Group, which is a part of Sharp Healthcare, and I've been with them for about 2 years, and I'm very excited to be here to give this talk. I am very grateful to have some of your time today, and I will be talking about quality, keeping your keeping quality in your care, and how to get the most out of your telemedicine visit. And of course, this is a topic that has been very timely and very important with the onset of the coronavirus pandemic. It is a very, very salient and necessary topic. And so we'll get right into it. All right, so let's go to the next slide. All right, so I want to start out by talking about Sharp in general. Sharp is the largest medical provider in San Diego County, and we have 4 acute care hospitals and 3 specialty hospitals. We have skilled nursing facilities and several medical clinics and urgent care centers. And if you live in San Diego, most likely you've driven by a Sharp facility. It really is a wonderful group to be part of. When I was moving here to San Diego, I wanted to join a group that was going to give me the ability as a primary care physician to take care of my patient in a very comprehensive manner. And this is what I found here. We are able to take care of our patients not only when they're feeling well, but when the inevitable at times happens, which is when you need emergency care, even after you've been in the hospital, the fact that we have skilled nursing and even rehab facilities. So it is very, very comprehensive, and it is wonderful because everyone is an advocate for the patient and communicates very well with us as primary care physicians, and it has been very gratifying to be a part of Sharp. And we, of course, have our Sharp Health Plan, and we also accept Medicare. So wanted everyone to be aware of that. And we can move on to the next slide. All right, so telemedicine, what does that mean? So of course, it can mean a lot of different things, and it also is something that understandably strikes a lot of fear into the minds of patients because I think a lot of times we look at telemedicine as not being as adequate or as comprehensive as in-person care. And actually, prior to the pandemic, a lot of physicians actually and medical providers also felt this way. But with the onset of COVID, this really became a necessity because of the need for distancing. Of course, this was a very scary time in the beginning of 2020. And so we really have been able to pivot and actually offer comprehensive care through telemedicine. And these are some of the things that we can offer, which is caring for our patients that have conditions like congestive heart failure. We have chronic care nursing, we have home care visits, we are able to do consultations with other providers virtually, and you're actually able to have video visits with your own provider, which is really, really wonderful. And things like dermatology, for example, or even mental health care, follow-up surgical care, these are things that actually can be done virtually. And it is a really, really wide world of it really opens up a lot in terms of what we can offer, and it actually makes our care a lot more comprehensive. And so we can move on to the next slide. And these are just some testimonials from some of my colleagues, and also from patients who have said that it really has been great for them to be able to access this, even for mental health care, for example, and the fact that it can still be personable. It is still personable and personal. I have several video visits throughout the day, sometimes have phone visits throughout the day, and it really has enabled me to connect with my patients, and it's very convenient for a lot of patients who for whatever reason may not be able to come in person to be seen. And I think it's really been wonderful. All right, so let's go to the next slide. And this is just an overview about telehealth and what it means for older adults. And essentially, it's just emphasizing that that the pandemic did create a need for this, and there was a 300% increase in virtual doctor visits among Medicare eligible seniors since March of last year. 300% increase, which is staggering. And in the future, there is an expectation that 20 to 30% of all medical care is expected to be delivered digitally from now on. And again, I actually have a very large panel of geriatric patients because I took over a practice from a physician that had been with Sharp for over, I think, about 25 years, and such a long time, which again is not uncommon with Sharp because it's just such a wonderful place to work. Many providers, in fact, the overwhelming majority of providers stay here for a very, very long time. Of course, it helps that we do live in San Diego, which is beautiful and sunny, so it's hard to leave. But really, the fact that it's a medical group that is just so wonderful to work for. But so a lot of coming back to the future of healthcare, a lot of my patients initially expressed concern about this, understandably, that again, I may not be able to access a computer, this may not be for me. And hopefully as we go through this presentation, we can allay some of that fears and talk about how this has actually worked really beautifully well in a lot of cases. And so we can go on to the next slide. All right, and this is just some highlights that we had in the press about this. And again, recognizing that there was such a need in this, the media actually recognized this because they were seeing that telehealth was actually increasing in terms of its popularity with the pandemic. And this was a highlight that we had in the press because of how well we have been able to deliver care to patients. And we can move on to the next slide. All right, we can go to the next slide if we can. I think we're trying to get past, and we can just move past this one as well. All right, and so talking about, again, about the kind of services that we can provide virtual urgent care, which actually has been a very, very good thing for our patients, in that a lot of times you can't get to the doctor, but you have an urgent need. You can't get to us physically in person, but we are able actually to provide virtual urgent care, even emergency care in some cases. And so what this does is it enables you to have access to a physician pretty much almost all the time. It really makes it easy to access care. And if you do need to be seen in person, then we can advise you of that. But there are a lot of times that you may not need to be seen in person for a lot of different conditions, which we can talk about. And it really has been a big convenience for patients, and it has worked really, really well for us, which has been wonderful. And we can go to the next slide. All right, and so essentially what we started to see with COVID was that, of course, because we had to, as every single medical group all across the country had to limit our in-person visits because of the distancing requirements at the time, there wasn't a lot of knowledge about COVID and how to essentially handle it and take care of it and how to protect patients from it. We wanted to be as safe as possible and follow all the guidelines. And because of that, there was a limitation in how many patients we could see in person. And of course, this led to really long wait times for triage. Calls increased by 400%. And we do have, by the way, triage RNs, which is another really good service that we are able to provide. So you really can talk to a nurse at any time, really 24/7. But the calls, of course, increased, and our contact center was really overwhelmed. And again, there was a limitation in the amount of space that we had. And so if we go on to the next slide, within 10 days of COVID, and again, this was one of the things that really make this such an excellent place to work. Within 10 days, our leadership had met and came to a solution, which was to basically figure out the way to make our schedules support triage. We found space for doctors, and we were able to have some doctors, for example, working from home virtually, and other doctors in clinic. And we also used our existing technology to be able to support call volumes. And doctors even started to do things like add patients onto their schedules, which we always do when we can. Started taking incoming calls. We started engaging with our patient service reps to really offer care to the patient and avoid in-person visits when we could. And I have to tell you that we have not stopped working, since the pandemic. It was a busy time, but we really were able to rise to this occasion and actually start to realize that there are many things that we can treat virtually. And this has been such a big convenience for patients, and we continue to incorporate that into our practice. And it's actually enabled us to see more patients throughout the day and be able to provide care for more patients throughout the day. So we always have to try to find the silver lining in these situations. And this has been a really, really nice silver lining that has come out of all of this. And we can go on to the next slide. And again, coming back to virtual urgent care, just wanted to highlight that because, again, it's such a service that's very, very popular, available 7 days a week, 8 a.m. to 8 p.m. And you really can just get a same-day visit for whatever is going on for really most conditions that people will have urgently. And very quick scheduling online, which is very easy, but you can also do it by phone. And the fact that we were able to create this within such a short period of time took a lot of hard work, but we were able to do it, and it's still in place and has been really, really good for our patients. Next slide. All right, and then this just highlights some of the successes that we've had with it. We've been able to care for over 23,000 patients just through our virtual urgent care. And the fact that it was there at a time when there was so much uncertainty, but we were still able to continue to provide access to our providers, and patients are also able actually to message their doctors. So we have Follow My Health, where you can actually send us messages and send us emails about whatever might be going on. We can get you into virtual urgent care the same day if you need it. And it really has been a big success and something that we're extremely proud of. And we can go to the next slide. All right, and so again, what we try to do within Sharp is to try to make sure that we keep your care with the provider that knows you really well. And it actually works out really well, especially in primary care. We really want to treat the person. We don't see you as a patient, we see you as a person. And having someone that knows you, has a relationship with you, makes all the difference. Certainly we have a very comprehensive medical record and work very closely with our partners within the same clinic. So if your doctor's not available, of course, there's someone available that can step in, but we try to keep everything seamless and with one person so that you feel that you are connected and it's someone that has known you for a very long time, which of course is one of the reasons why we go into family medicine or internal medicine or pediatrics, other parts of primary care, is to know the patient. And really, this has been really great because with telehealth, again, we can add more visits to our schedule. We can provide more comprehensive care. So if it's something that in a lot of cases may not need you to be seen in person, we can take care of it, and we can always bring you back at a later time to see how well you're doing with the care that we've provided. So it really does get you quicker care and personalized care, and it is really wonderful. So let's go to the next slide. All right, and this is again talking about what the Sharp experience is essentially, which is to treat the patient comprehensively, to provide affordable, good care with someone that you're familiar with and not just a random physician. And let's go to the next slide. All right. And we'll go to the next slide after that. All right, and so these are just some testimonials from both patients and providers again. And a lot of our patients, even back then, we wanted to keep, especially our older patients, we wanted to keep safe. And at the time, again, with the pandemic, when there were no vaccines, COVID was still spreading in the community. And so there was some risk of coming into the clinic. Of course, we've always kept the highest standards, so we all wear masks, and we do know and do a really good job of preventing you from getting infected when you come into the clinic. We've had really good success with that. But of course, there's still that risk, especially for our older patients. And so the fact that we were able to provide this was really great. And a lot of times, it actually does help patients when they're in an environment that they're familiar with. When you're home, you don't have to worry about parking. You don't have to worry about rushing into the clinic. You can just really just with a click of a button be connected with your doctor. It really does help in terms of managing chronic conditions, acute conditions, and I think that is really great. And so these are some testimonials that we've gotten from some of our providers and from our patients. And we can go to the next slide. All right, and then there's always that concern, of course, that a lot of people have when it comes to insurance coverage. And the good thing was that there was an expansion of telehealth with a 1135 waiver. And under this new waiver, Medicare is paying for office and hospital visits that are done through telemedicine, and even right at the patient's home. It was actually a really good thing because in the past, coverage was very limited and only reserved to rural areas where people may not have been able to get to the doctor. But now the coverage is more consistent. Of course, there might be co-pays and co-insurances, so always check with your insurance and your specific provider. But this was another thing that was really great that came out of the pandemic, was that insurance companies started to realize that this was a great way to actually provide care, and in a lot of cases keep patients out of the hospital and still keep them connected to their providers. So this has been a really, really great thing. All right, so let's go to the next slide. All right, and so now coming back again to talking about telemedicine and how that can be applicable for patients. So the first thing is that it's important to think of telemedicine as being just as valuable as in-person visits. And I think that a lot of apprehension stems from the fact that patients feel that, I don't want to just be seen over the video. I'm not good with the video. I'm not good with the phone. And I really want to see my doctor in person. I do want to make it clear that we will make that available, and we have always made that available. And now with the vaccines being in place, we're full speed ahead with seeing you in person. So we do that, but we also want to highlight the fact that in many cases, there's actually a value that telemedicine provides, and it actually, in the end, provides more access and greater access to patients. And I've had this happen in my practice personally. I've actually been able to connect more with my patients because many times it may just be something simple that we need to talk about. They may need something ordered, or it's something minor, a skin condition that's really minor. I can get them right on my schedule. We talk, I'm able to see what's going on, and we're able to treat it. And then I see them back at their follow-up. Whereas in the past, we would have to wait and there might be a delay because we can't get you there in person. So they are absolutely valuable. And actually, I would say crucial at this point because it really does help us to provide more care. And so I definitely want to encourage everyone to not be too apprehensive about it because it is a great thing, and highlighting the fact that you don't have to worry about transportation. In some cases, some people have childcare costs, or they have to find someone to take care of their grandchildren if they're caring for them. A lot of people have mobility issues and it might be difficult to get to the doctor's office. The fact that we can provide you care at home is really great. You don't have to wait in the waiting room. You can really just, sit there with your lunch or your dinner and, or turn off the TV and, and click a button again, be connected with your provider. So it definitely leads to better health overall. And if we do need to see you in person, we still get you in. So there are really no downsides when it comes to this. And then we can go to the next slide. All right, and then also the fact that not only are primary care physicians doing this, I want to highlight the fact that not only are primary care physicians doing this, but the specialists are also doing this. And again, primary care access has been traditionally difficult for a lot of people, a lot of healthcare systems, just in general, but not just primary care access, specialist access as well. And this has really enabled us to be able to get easy access both to primary care physicians and the specialists. And it's really, really great that they're also doing this. So whether it's cardiology or GI doctors, they're able to provide care via telemedicine, and it leads to earlier diagnoses, and we've been able to eliminate delays in diagnosis because of this. And it's been really great, and our specialists have been able to pivot to doing this when it's necessary, and it's been great, not just for acute conditions, but also for chronic conditions. And a lot of patients give us the feedback that they feel a lot less anxious when they can be in their home setting, when we can do this. And also family members can participate. So it makes it a lot easier. You can have more than one family member participating. There are options to add a lot of people to calls or video visits. And in the past, when this was difficult to do because you may not be able to have your appointment at the same time when your family member can come in, this actually expands that access and expands the ranges of time that we can do these visits. And it has been very helpful for us to be able to see the patient as a whole, and that's been really wonderful. So let's go to the next slide. All right, so some tips with telemedicine. The first thing is that you don't have to be someone who is a tech whiz or great at technology to be able to access telemedicine. You really just need an internet connection. That's really what you need. And we do have specialists that can actually help you set it up. I've had patients that are in their 80s and even in their 90s that I have telemedicine visits with that, again, we're very worried about this and very scared to participate in it. But now they are able to do it because we've just made it so easy. It's really as easy as clicking a link in a button. But you do want to make sure that you follow those steps prior to starting your session. So make sure that you test your connection. And again, we will give you those instructions on how to do it. We have specialists that really will walk you through what you need to do. And you want to do that prior to starting your session and test your connection. And also, of course, be in a quiet place for a visit. So many times, I've, had, things that are going on in the background. And a lot of times people may be trying to do this in a place where it's loud and we can't really connect very well. You want to try to be in a quiet place and adequate lighting if possible. Again, it's not necessary. Just adequate lighting helps. However, if it's something, for example, in your skin that we need to look at, that really helps. And of course, make sure that you write down whatever concerns or questions that you have. And that's just important for doctor visits in general. It's so easy to forget what you may have wanted to ask in the moment. And so it's very important that you prepare by writing things down. I always encourage patients to do that because it is hard to remember everything. A lot of times when you think you will, at the end of the visit, you're like, oh, I forgot to mention this. And it definitely helps us to be able to go through all your concerns and to be able to address them. If you write them down, making a list is always, always very important. If family members have concerns, you can always write those down as well. And so make sure that you do all of that. And so we can go to the next slide. All right, and of course, having something handy to take notes. So a lot of times we may, for example, give you a number to call for radiology scheduling. There are things that we may say that you may forget. And so it's always important to make sure that you have a pen and paper handy. That's really, really important. And also remember that telemedicine is not just video. we can actually do a lot of things over the phone. And so if you don't have a video connection, that's okay. We can still do a telemedicine visit. And it's always important to have your phone as a backup, because a lot of times there might be issues with the video connection. And make sure that you have your pharmacy available, your medications that you're taking. If you haven't been seen before, we can facilitate getting your medical records prior to your visit. And so that's very important to try to do. And always ask questions. Always make sure that you try to understand what your instructions are for follow-ups, what the next steps are. This is something that a lot of patients understandably have given feedback when I've worked at other healthcare systems about, which is that I didn't understand what the doctor was saying, or I didn't understand, what they were trying to tell me. And here at Sharp, we definitely emphasize this with all our providers, and we want to make sure that we are communicating well with our patients and addressing their concerns. And it's something that we always work on. And so we want to encourage you to ask questions. We really like when you do this. And so make sure that you do that. Let's go to the next slide.
You are such a wealth of information. Thank you so much, Dr. Olulade. We have terrific questions coming from both the YouTube audience and the Zoom audience. So before our time is up, I'd love to pose a few of those. Mike and Penny are asking, is my video appointment recorded? And does the video become part of my medical records? How is my privacy protected?
So that is a very good question. We actually don't record your video visits. We don't do that. And as every healthcare system, we are very, very focused on privacy and protecting the patient. So there are a lot of security firewalls that are in place. And we have things like two-factor authentication. So we definitely protect the visit itself, just like we protect your medical records. So you should feel very safe when you are doing this, but we don't record your video visits.
Thank you so much. This is helpful to know. Next question is coming from Angie. Angie saying, from where I am, it seems like every doctor has a different online app and nobody's sharing. What do you see for the future about the situation?
This is a very good question. That's a great question, because I do think that it would be great to have a comprehensive universal electronic health record. And hopefully that's something that we can move toward as a country. But I would say that at Sharp, we actually have really, really good ways to get your records from healthcare providers, even within San Diego and outside of San Diego. So we have an really excellent medical records department. I mean, I've requested records in a day, and even in hours at times. They're able to get us records very quickly. They're experienced at doing this. And so it hasn't been a limitation for us. And of course, we do have an electronic health record as well. So that is really a good thing.
Excellent. Next, I'd like to take a question from Saretta. Saretta is asking, are there advantages to having Medicare through one healthcare system versus another? Could you speak to that?
I can't really, I'm not sure that I fully understand that question in general, but certainly, with your insurance plan, we do take Medicare, and I haven't seen a limitation in terms of providing care with our healthcare system. And so regardless, we take really a lot of healthcare plans, and I haven't seen that as being an issue in terms of providing coverage. So I would say that you should definitely, when you're choosing your health insurance plan, to ask your representative or even ask us. We're definitely available to help you in terms of trying to decide what plan to get. And so that's what I would say to that.
Okay, last question. Because of telemedicine, and thank you for pointing out that this is such an easy way to get your family involved, unlike going to a physical location. Are telemedicine visits shorter? Are they longer? Are they about the same typically? Anything you can tell us that will say, well, I could go in person or I could do telehealth. What's the difference if I have the opportunity to do either?
Absolutely. So I would say that they are comprehensive. They're just as comprehensive. I would say that they are equal to in-person visits because they're tailored to what you need at that time. So it depends on what's going on. So if you have a lot of concerns that we're addressing, then we will take the time to address those concerns just like you were in person. Certainly they're more convenient and you don't have that time of checking in and waiting in the waiting room. And so that actually does give the upper hand in that case to telemedicine. But the approach that we take is to really tailor it to whatever you need and whatever is going on at that time. So sometimes they're longer because they need to be, sometimes they're shorter because you don't need as much in that visit. And so I think the important thing is to remember that they're just as valuable as in-person visit and they are tailored to what you need at that time.
Excellent. Thank you so much for joining us. We enjoyed learning from you today.
Thank you so much for having me.